Hello, my name is Evelyn, and I'm going to be talking about enhancing workplace and civility. This, I am going to be basing it off of a previous submission on a made up hospital or workplace, and I decided to make it based off a hospital named Naples Farms. So the objective for this project is to be able to develop an initiative strategy to improve civility and diversity in the healthcare workplace, such as with Naples Farms. Um, we want to be able to demonstrate an understanding on what this means, how this works within the workforce, and how it leads to equity, communication, and competency. So here I put the Naples Farms project that we had with the policy name, and just a bit of a background policy statement, and a couple of terms just to reflect on. So for the workplace assessment summary based off of module 4, we identified that there were strengths of diversity, basic professionalism, and shared values within the community. The weaknesses that were also present were inconsistent communication, limited cultural education, and lack of inclusive programs. So many times workplaces limit that just to keep things fair and just, but at the same time, that is unfair and unjust. Opportunities that will be provided would be training, classes, expanding cultural awareness, such as with inclusivity programs. With this, some risks could be miscommunication, uncivil behavior, and patient care disparities. Sorry. Sometimes people see that it is unfair that so and so gets this when so and so doesn't, but it's an idea of basic rights for everybody and including everybody. So that is the risk we are taking with this assessment. So going back to what Naples Farms is, it is a hospital. I made it up, but let's say it is a hospital that includes diverse staff, nurses, doctors. All of the employees within are very diverse. We emphasize teamwork, communication, client safety, and cultural respect. The current gap is that there's no structured program to be able to support ongoing cultural competencies. Sorry. So that's how we want to build up with this. So taking action, increase workplace stability and cultural awareness by, let's say, 40% within the next 6 months. And this can be measured through incident reports, post-training surveys, talking with the staff, as well as the patients that are being cared for. Initiative. So we want to choose a strategy that directly aligns with the problem that we identify. It supports policy, respect, communication, and equity. We want to be able to show that it includes everybody, regardless of background. What this training means is there's going to be a structured educational program teaching, respecting with respectful communication, cultural sensitivity, professionalism, and then we want to focus on reducing bias, promoting inclusive behaviors, things like that, to not feel other people, to not make other people feel intimidated, but included. How we will implement this, I try to make it to where we have like 4 different sections. So quarterly workshops, scenario-based learning, measuring improvements, and then leadership participation, which is very needed to help organize things and keep things flowing. Some key terms that I found were civility, equity, culture, and professionalism. Here they are defined. These are words that are mentioned a few times throughout this and may need some explaining. Milestones. Here again, I divided it into 3 different sections. We have the developmental stage, the launching stage, and the evaluation and adjustment. First one is about a month in, second one is 2 months in, and the last one is 3 to 4 months. We want to schedule these workshops, talk with facility, make it. Second stage would be training, ensuring everybody's participating, and then collecting assessments. milestone 3 would be actually evaluating the assessments and taking things into consideration. How we will measure this, like I said, we can take reports and looking at incident reports, staff feedback, and then training surveys to see what people are getting from these trainings. With leadership, we see that it is an important role because people look up to people with leadership roles. It's for safety, for inspiration, and to be able to help uh, carry on the open communication and feedback for the rest of the people. In conclusion, I want to say that the training is meant to help people be able to communicate respectfully, understand cultural differences, and minimize conflict. It's aimed to build a healthier workplace culture, um, but there can be negative sides to it, but we aim for the good side. As I reflect through this, I am able to see that civility in the workplace, civility and diversity in the workplace is essential to building a great team. But it does require a lot of training and respect of other people's backgrounds, being able to understand their values. As I stated here, as nurses, we take care of a lot of different patients and we have to work with different people with different backgrounds. So it's kind of a necessity to be able to learn from others, um, respecting them, regardless of what you feel at that moment. I think respect is key. And that is everything. Thank you.